Hi, everyone. Today I'm here with Nate, a physical therapist and a manager of inpatient rehab in a hospital of the greater Sacramento area. So thank you, Nate, for being a part of this interview.
Thanks for having me.
And before we get into the details of physical therapy, what exactly is physical therapy? And what are the subspecialties of physical therapy?
Physical therapy is a really broad profession. We help restore function of individuals, and the subspecialties range from many specialties such as pediatrics, inpatient, outpatient, burns, neuro. I mean, the list goes on. So I could sit here and tell you about uh, tons of subspecialties. What's amazing is now physical therapy is breaking into non-clinical roles as well. So the profession is actually growing.
What are the most common cases that you see in a day on the inpatient side and maybe the outpatient side? Since right now you're more on the managerial side of things, maybe you could take us back to like when you were on the inpatient side and maybe your colleagues on the outpatient side as well.
Yeah, so when I met you, I was working in a surgical intensive care unit. So I saw a lot of thoracic surgery patients the day after they had surgery. So early mobilization is a very important thing within a hospital setting. The sooner people are able to move, once they're medically stable to move, the better the outcomes. So that was my last clinical role. So now as a manager, I am a manager of 38 employees, speech therapists, occupational therapists, and physical therapists. We see everything from, cardiac to orthopedics and neuro. So yeah, wide range every day.
What is the scope of a physical therapist versus, let's say, another healthcare professional like a PM&R doctor or a sports medicine doctor who's like a primary care physician, or even like a massage therapist or a chiropractor?
Oh, that's very loaded question. So similar to, I would say, a physical therapist, we cannot prescribe medicine, but we could prescribe exercise under um, the direction or under the supervision of a physician. So we need to receive an order first, and then we would assess a patient and prescribe. So that's the difference. I mean, there's a big difference between a physician and a physical therapist, but um, we're independent clinicians. So doctors don't come to us and say, this is what you're going to do with our patient. We're going to give you an order, but they trust our judgment based on our skill level to assess and determine what functional impairments there are or mobility impairments, and then set some goals and try to eliminate those and restore normal function. Massage therapists were there's a significant difference between a massage therapist. They may help with tissues, but we're restoring, we're going to measure range of motion, we're going to measure strength, we're going to measure sensation and neurological deficits, and then help restore function based on those impairments.
Could you kind of walk us through maybe like the general methodology of physical therapy, like how you guys approach problems in general with like rehab or let's say a post-op patient or a sports injury or things like that? How do you just kind of like assess the situation and proceed from there? Remember you talking to me when I was on the med surg unit about I think even the difference between chiropractors and a physical therapist being like one is like loosening, I think, and one is more like building support and stability. So could you kind of give us an overview of like the general methodology of physical therapists and how they approach these things like rehab or um, sports injury versus like a post-op patient?
There's so much to talk about there. I don't even know how to address that. But, again, it goes back to assessing for impairments and trying to restore normal function based on what our findings are. So if, let's say a joint is stiff, we're going to help mobilize and stretch that joint, or maybe stable on one side and lax on the other side. So we're going to have to provide stabilization on the side that's loose, and we're going to probably have to stretch the side that is shortened. So finding the right symmetry and then also strength is very important. And that's just speaking to the specifics. The chiropractic versus physical therapists, I get that question a lot. I have a lot of respect for chiropractors, and chiropractors have their place. The business model is significantly different from a physical therapist business model in an outpatient setting. Physical therapists generally have a short-term plan of care, anywhere from 3 to 6 weeks over 2 sessions per week, with the ultimate goal of making the patient independent in their plan of care. So if they have pain or if they have mobility impairments, the goal is to restore that function and then teach them how to do it on their own, with the ultimate goal of them not needing to come back. On the flip side of that, the chiropractic business model, I keep losing my screen, so let me get my screen back up. Sorry about that. They are a quick fix. They do a lot of manipulation, and so if you have a rib that's just bugging you, and they can manipulate you, but sometimes that creates a laxity. And I think one thing, and not to have a slant on chiropractic, but one thing that is common is when patients go, or clients go to chiropractic care, they typically are reliant on chiropractic care. And that's kind of the business model too, is to have you keep coming back. So I don't know if that's being mean, but I mean, again, I've been to chiropractic care and I've been helped by chiropractors, so I know they have their place.
Why did you choose physical therapy and your specific subspecialty, if you have one?
I was a baseball player. I hurt my shoulder in college. I was going into my junior year, had shoulder surgery. The rehab process did not go as quickly as it should have. So I needed a lot of physical therapy. And at that time, I was going to a sports med clinic at University of Nevada, Reno. And I was just in awe of the clinic, of the profession. And, I was taken back. I'm like, this is actually a career. This is amazing. Like it was super cool environment. So it kind of planted the seed. And then I went back, actually I dropped out of school at that time because I stopped playing baseball. So I felt kind of lost. I went into sales till about 25 and went back to school because I really wanted to be a physical therapist. So subspecialty, I didn't get any advanced certifications, but I've done a lot of different things within my career. I started in an outpatient setting and then quickly went into the inpatient setting. I've done home health. I've worked in the intensive care unit where I met you. I've been a acute rehab liaison. That was a non-clinical role, and that's where you screen and identify patients that are appropriate for intensive therapies. It's an inpatient rehab program, so where you would see spinal cord injuries, traumatic brain injuries, stroke patients, and then most recently promoted to a manager position.
Okay. And since you have worked in all these different areas as a physical therapist, I think this is a good question. What is a typical day in your life like now? And what was it in some of those different roles that you had, whether it was in home health or whether it was in outpatient, I'm assuming private practice, or in the ICU? What was your day like in each of those settings, and how is it different from what it is now in your managerial role?
The ultimate goal every day when I get up is to make a difference in somebody's life. So you get up bright and early and go to work. And, I've had a high level of satisfaction in this career. When I get in my car at the end of the day, I smile, because I know I made a difference. Now, the magnitude of helping people has kind of grown over the years as I've gone into other positions. So as a manager, you actually get to impact more patients on a daily basis because you're helping your 38 employees provide care. So it gives a high degree, although it is very hard work, it gives a high degree of satisfaction. So does that answer that?
Yeah, and also could you
Not
maybe
directly, I guess.
could you I mean that's a good kind of macroscopic overview. Could you give us maybe some like maybe hours that a physical therapist would work in either on the managerial side but also on, let's say, on the inpatient service or on the outpatient setting?
Outpatient setting, I typically worked 7 to 4 o'clock. There's a lot of flexibility on the inpatient side. Patients are in the hospital. We do early mobilization. Not only does that mean early in the morning, but it means early in their illness, get them moving. But when I worked in the intensive care unit, I was working 5 to 1:30 shifts. And there was a huge impact, a huge, what do I want to say, benefit to not only the patient, but the hospital. Patients that start moving early have a decreased length of stay, not only in the ICU, but in the hospital. So, and it actually may impact their discharge dispositions. So instead of going to a skilled nursing facility for rehab, they'll probably go home. So it's very important. So yeah, there's a lot of flexibility though. I mean, in the inpatient side, I came in early in the ICU, but we also have an orthopedic surgery program. We see patients day of surgery, so total knee replacements, total hip replacements. We're getting them up on their feet and walking 10 or more feet on their first physical therapy session, which is the day of surgery, oftentimes within 2 hours post-surgery. And again, that is a significant improvement in their outcomes. There's a lot of research on that as well. So the earlier patients start moving, especially after orthopedic surgery, the better the outcomes of mortality, range of motion, strength, the health of the knee, pain. So, I mean, and decreased risk of DVT. So it's very important. So those therapists typically come in around 10 or 11 in the morning and stay till like 7 or 8 o'clock at night.
Okay, and do you guys have like shift work or call days or things like that, or is it like a Monday through Friday type of deal, or how is it like?
So hospital setting is 24/7, 365. However, physical therapy, occupational therapy, speech therapy, we're typically anywhere from 5 in the morning till 7 or 8 o'clock at night. We don't work throughout the night. There are some hospital settings that do, not very many, and I don't think any in this service area. So yeah, we do work weekend shifts. A lot of the therapists start out their career working Sunday through Thursday or a Tuesday through Saturday shift, so we cover the weekend.
Mm-hmm. And how do you say the lifestyle? I mean, we talked a little bit about this already, but how do you say the lifestyle of a physical therapist is like in the inpatient, outpatient setting? You mentioned the inpatient's a little bit more flexible, but how is the lifestyle in general? And then how is that compared to maybe other healthcare providers?
I think we have a very high job satisfaction. I think we are ranked number 3 the last I looked, and that was probably 2 or 3 years ago. So I think generally we're very happy people. The lifestyle, I mean, we don't make what doctors make, but I think we're compensated fairly well. I think recently, I think this goes for a lot of other professions, but the tuition it takes to get a degree is growing, and our pay is not. So I think there's a big gap there. So we're not netting as much as probably we should, but that's a whole different topic to talk about. But I think we're compensated pretty well. I think I graduated at the right time before we had this inflation and tuition. So, I do pretty well.
And what's the most challenging aspect of being a physical therapist?
Getting attached to your patient. So in the hospital setting, I've had a couple patients in the ICU that succumb to their illness, and I think when you spend a lot of time with those patients and you see them make progress, and you have to motivate people, and it's really hard when you see them go forward and you're just almost it's tough because you almost feel like you're giving a false promise. But you have to find ways to motivate patients. So when patients pass away, which is not very often, it's very hard. I've had a couple instances that happened right around the holidays, and I had a really hard time with that, and I still to this day have difficulty with that. But that doesn't go for all physical therapists. I mean, this is when you work in an intensive care unit. I mean, it's to be expected. So there's other there's other specialties, the outpatient setting and home health, where you're not going to deal with that.
What's the most rewarding aspect of being a physical therapist?
Empowering somebody to regain normal function again. So people come to you with a thorn in their hand, and or a splinter, and a lot of times they're desperate, and if you could help them see the light and also improve their function and overall quality of life, it's super rewarding. I've seen patients so sick that when I walk by their room, the nurses would tell me, don't even think about it. They're never going to have a physical therapy order. And 3 months later, I get a physical therapy order, and the woman couldn't even move her fingers. She was so weak. It was a daily project for, I would say, about 6 weeks, but I got her up on her feet and into a recliner and brought her outside in sunshine after 4 months. And that woman ended up walking about 10 feet before leaving the hospital. She went away to a subacute rehab center, and she walked into our unit a couple months later to thank me. That was amazing.
It's powerful. Are there any misconceptions about physical therapy?
Yes. Physical therapy, just PT, the acronym PT alone, I think a lot of people claim that it means pain and torture, or physical terrorists. Sometimes, and then the no pain, no gain. I don't believe in that. I really don't. Like, even as an outpatient therapist, there are ways to promote healthy mobility without inflicting pain. Now, there's some things that may be a little uncomfortable, but we're not there to torture. But with restoration of normal function, usually pain goes away. So I think that's probably, people are reluctant to go to physical therapy because they're afraid that they're already in pain. They don't want to be in more pain.
Are there certain personality types or qualities that you see in individuals that are best suited for physical therapy?
I haven't met very many therapists that I haven't liked. I think just generally very compassionate people that care about people, that just want to do good, want to help people. I think doctors are very similar in that nature. I think a lot of professions are, but I think therapists, physical therapists, occupational therapists, speech therapists are just generally awesome people, good people to be around.
How do you go about becoming a physical therapist? Are there certain exams or certifications that you need to get in, or to have certifications or qualifications once you graduate?
Yeah. So in order to apply for physical therapy school, you must have a bachelor's of science and take whatever prerequisite courses, whatever institution you're going to be applying to. So I went to California State University, Sacramento. I majored in kinesiology, which caters to, it's pretty much a pre-physical therapy program with the emphasis of therapeutic exercise and rehab. And then there was a few other prerequisites that were required. And then you have to apply and be accepted from a accredited physical therapy school. As of 2013, all physical therapy schools are doctorate level. So that means about a 3.5 year, 4 year physical therapy program. You have to have your doctorate of physical therapy to take a state and national board exam and pass the board exam to become a physical therapist.
And what tips would you give to get into a competitive physical therapy program? And I'm not sure if there are residencies or specialty programs afterwards. What tips would you give to get into those programs after physical therapy school?
Yeah, I would even take it a step further back. I think, just like being a doctor, 7 years is a long time to go to school. I think it's important for people to do some observation, go to a clinic, go to a hospital, ask the volunteer, see if you could observe to see if it's something you want to do first. I think that's important. But as far as getting into physical therapy school, it's very competitive. I highly recommend getting all A's. You may have a B here and there, but your GPA needs to be close to 3.85 or above to be even considered. Be social, be interactive, volunteer, help out. That looks good on your resume, and when you apply on your application to physical therapy school. As far as specialty programs, there's so many specialty programs within physical therapy. There's an orthopedic clinical specialty. There's a neurological clinical specialty. There are proprioceptive neuromuscular facilitation specialties. So if you're going to do that, I highly recommend you spend a lot of time in those areas. So if you want to do orthopedics, you would probably want to work in an outpatient orthopedic setting to get hours and have somebody have a preceptor that has that specialty to help guide you, and they sign off on your hours as well.
Since you mentioned a lot of these programs now have moved on to doctorate programs, what's your opinion? It seems like there's some controversy about the title of being a doctor in a healthcare setting. What's your opinion on the use of the doctor title for physical therapists versus physicians versus other healthcare providers?
Physical therapy doctorate, it's a clinical doctorate. I haven't met very many physical therapists that go by doctor. They go by a first name. It's a personal preference thing, and I get it. People, they invest a lot of time and effort to become a doctor of physical therapy, and there are doctors of physical therapy that like to be called doctor. I really don't have a personal opinion. I think that it could create confusion, and I think you just have to be aware of your situation. Is it going to confuse the patient? Is it going to confuse a family member? You definitely don't want to set an impression that you are a medical physician and you're going to be prescribing treatment. It's not a good situation to be in anyway.
What employment types and practice settings are available to physical therapists, and what are like the pros and cons of each? Since it seems like you have worked in a lot of these settings, like you mentioned, home health or private practice, or outpatient, inpatient, and even managerial positions. What are the different pros and cons of each of these settings?
Yeah, the cons to the setting I work in is we operate 365 days a year, so we do have to cover Christmas, Thanksgiving, and all the big holidays. There are different levels of employment which are beneficial, but they have drawbacks as well. So I started out as a per diem employee at a hospital setting, and the pay is pretty nice, but you don't get benefits. You don't get paid time off. You don't get insurance. So the drawback is if you're not working, you're not making money, and then you would have to pay for your own insurance. So it becomes quite difficult, and you burn out quickly, especially if you're working full-time hours. The benefits of being full-time or part-time and having benefits is you accrue paid time off and you have benefits, so that's nice. The drawbacks of home health I found were driving place to place. So I lived about 45 miles away from my service area. So I was driving a long ways in, and then I was driving from home to home across town. So I was driving 100 plus hours or miles per day. So that made it very difficult.
And then how about maybe outpatient private practice versus like the hospital setting?
Good question. So outpatient setting is very fast paced, very concentrated. You see a lot of patients in one day. Um, you typically have a lot of paperwork. So at the end of the day, you're not going to get paid to do paperwork, but you may see upwards to 18 to 22 patients in a day, and you have a stack of files on your desk. Well, at the time of me being outpatient was paper based. Now it's mostly electronic medical records. So, but still, nonetheless, it takes a lot of time to document and coordinate and send updates to physicians for signature. So that's kind of the burden of home health as well. The paperwork side of things. It's just a lot of redundancies. Inpatient, I like because you clock in, you see your patient load in whatever order you want, and you clock out and you're done for the day. You don't need to go home and make phone calls and, coordinate care with the physician. So, that's the risk reward between both.
Okay. And what kind of roles or opportunities can a physical therapist work in? You mentioned, for example, in terms of advancement, you're able to work in different roles. Like, for example, now you're a manager of a large team. What kind of opportunities are there? Like, can you do like public health work, or like how does that work out?
I suppose you can. You could do. I've seen people do a lot of consulting gigs. I've seen care coordination. I've seen there's a non-clinical website. I mean, and every day I just feel like the list just keeps growing. It's insane how many different things you can do with our degree and our knowledge, and we are valuable in our perspective. So it's nice to see the growth. Um, from the clinical side of things, I mean, you could do wound care, you could do, sports medicine, you could work with geriatric population, balance, there's so many different things. And what's awesome is you could dabble in all of these, so like I could work in an inpatient Monday through Friday. And then on the weekend, I could be a per diem somewhere and work somewhere else, just for fun. So, and I see a lot of that, like Rehab Without Walls is a very good community based rehab program for people that have had traumatic brain injuries or spinal cord injuries. And they're getting, it's separate from home health. It's a more intensive therapy, but in the home setting. And, I see a lot of that too with a lot of our clinicians.
And moving on to more of the employment side of things, how well are physical therapists compensated generally? And how does that vary based on maybe the setting that they're in or what subspecialty they're part of?
That's a tough question to answer. It varies across the market. In California, I think we're compensated better than, Florida per se, or back east. Outpatient, you're going to make a little bit less. Inpatient, you tend to make a little bit more. The benefits are much better. You get a lot more paid time off. You get a lot better health insurance. That's just what I've found personally. So a new grad would probably start, and these numbers, I don't even know for sure, but somewhere around $40 per hour.
What are ways to increase your income as a physical therapist or make more money? Is it more just working in the inpatient setting and then picking up those per diem shifts like you're mentioning, or are there other ways that they could do that?
That's a good way to supplement the income. I do know a few therapists that do private pay. They specialize in, let's say, the shoulder. I have a friend, he worked at a hospital setting, outpatient hospital setting. And on the weekends, he worked for a professional fighter. So not only did he see the professional fighter, but he saw his team. So he, supplemented his income significantly by just having cash-based payments from working with these fighters.
You mentioned that there's kind of a pull and a push kind of between the physical therapy, maybe outlook, because the costs of tuition are increasing, but the pay hasn't been increasing as much, that you feel is maybe not adequately compensated. What's the job outlook like for physical therapists? And do you feel like it's going to improve or maybe worsen over the next few decades?
I think over the next decade, it's going to be hard to speak to the next couple of decades, but I've seen personally over the last 5 years, students have been pushed away from our profession as it went from a master's level to a doctorate level, and the tuition costs versus the compensation, the disparity. So I think that trend will continue until something magical happens. I don't know what that will be, but I think generally therapists that you see graduate now, just that's their identity. That's who they want to be. And honestly, I think that's a good thing because we're having really top-notch therapists graduate who are very passionate about, taking care of the patient.
Mm-hmm. Plus, with less of them, that means there's good job security, right?
That's right.
So with all the advances in medicine and physical therapy, how do you stay on top of all these advances? Are there conferences that you go to or journals that you read, or what other things do you do to stay on top of everything?
Yeah, so I do a lot of online reading, publications and such. We are required to do 30 hours of CEUs every 2 years. A certain amount needs to be in ethics and CPR. But I've been to American Physical Therapy Association conferences across the U.S., in Boston and Washington, D.C. So it's very, very nice to go to those because you interact with a lot of different clinicians who bring a whole different perspective. And that's the beauty of our profession is, all these clinicians have so many different tools to do things, and we all get to the end goal just in a different way. So when you interact with these people and share your perspective and listen to theirs, it's amazing. It just helps you grow.
Okay. And with everything that you have to deal with, you mentioned some stressful times. How do you deal with burnout and maybe the stressful times, and how do you recommend preventing maybe a buildup of that stress and burnout?
It's important to take time for yourself. I've been through health concerns myself, but it's very important to exercise. I run a lot. It's very important that you exercise. It helps free the mind. We have a very physically demanding job, so it's important to stay in shape as well. Keep the core strong. But take time off. I'm actually on paid time off these next 3 days because I want to avoid the burnout. I think one of the strategies I had when I knew I was not going to be able to have time off was to mix it up, try a different floor, ask whoever was scheduling me, hey, I'm really burnt out. I've been in the ICU for the last 2 months. Can I just go to ortho today? And just having that new patient load really helps. So you just need to find creative ways to tweak things sometimes if you're not able to take time off.
And how do you establish a work-life balance, and what advice would you give others to establish that balance?
Take care of yourself first. I have 3 children and a wife. I think it's very important that family comes first. I've been fortunate to work for an organization that feels the same way, and they support that. So you need to find a place to work that supports that as well.
How has medicine changed since you started, and what future changes do you see in physical therapy in particular?
Who medicine is ever evolving. Technology is amazing. I have a list of things I could probably rant on, but I would say the push from just physical therapy to early mobility has been huge over the last 10 years, and the impact it has had has been amazing. Like I said earlier, these total knee replacements, total hip replacements, a lot of them are going home the same day or the next day after surgery. Um, when I first started, patients would be in the hospital for 4 or 5 days after they had a total knee replacement. So, I mean, that's a significant improvement. So, and a lot of them went to skilled nursing facility for rehab. I would say 90% of the patients go home now. So that's a huge shift. You're seeing this in the ICUs as well. So early mobilization in the ICU, we're seeing patients on ventilators and getting them up and walking with them in the ICUs. And that's decreasing mortality. And it's also improving functional measures and decreasing length of stay in the ICU, decreasing delirium, decreasing length of stay in the hospital. And then ultimately, hopefully, sending them home rather than to a skilled nursing facility for rehab.
Since a lot of physical therapy is convincing patients to adopt better behavioral changes, to adopt new maybe exercise regimens to help with their recovery and rehab, what tips would you give, or how do you convince patients to adopt these better lifestyle habits or to even be compliant with whatever exercise prescription you give them? Since I feel like a lot of behavioral change is necessary for any healthcare provider, whether it's a physician or a physical therapist or a nutritionist, what tips or what lessons have you learned that you feel would be useful for other professionals or even future physical therapists to help patients with these behavioral changes?
I think this goes for everyone in medicine. And I could tell you one word: education. You have to educate your patient to build value. You have to tell them, you have to show them, you have to explain why they are doing something. If you do not, there is no value. So if you have a shoulder injury and you say, I need you to just do this 10 times and then stretch it a little bit this way 7 times, you're not going to get buy-in. But if you explain, this is what the shoulder is, you have 4 muscles surrounding your humerus, and those 4 muscles constantly drive the ball into the center of the socket, no matter where your arm is in space. So if you have any imbalance in those muscles, you're going to have a disruptive joint. So you have to explain to them why you need to do these exercises is to make sure that the rotator cuff muscles are working. So that's just one little example. So I think you have to build value for the patient for them to understand.
Is there anything that you would change about your career or any regrets? Would you maybe have considered a different kind of healthcare profession or even something completely out of healthcare if you could go back, or would you have done physical therapy? Is there anything you would change?
No, I'm very, very satisfied in my career. I've been fortunate enough to try different things every few years, and they've been just as rewarding, if not more, each time. So I think I found a good niche. And I think if you like caring for people and helping people, this is a very awesome profession. So I wouldn't change a thing.
And last question, how do you become a good physical therapist? Any advice on becoming a good physical therapist or even just a good healthcare provider in general, if they're different?
Yeah, so I think education. I think go to school, learn the basics. It doesn't end there. I think you need to continue to expand and collaborate with, not just physical therapists, but speech therapists, occupational therapists, physicians, care coordination, care coordinators, discharge planners, and nurses. I think everybody has a lot to offer. So healthcare in itself isn't just one wheel. It's multiple wheels moving in unison. So I think it's important to be collaborative with other disciplines to ultimately help the patient achieve the best outcome.
Okay, that's good advice. So thank you, Nate, for being a part of this interview. And thanks to everyone who watched. If you have any questions, leave them down below in the comment section. I'll ask Nate and get back to you guys. Thank you again so much for watching. I hope you have a great rest of your day. Take care.